For you, we tested your left shoulder and your right shoulder. Okay, we know that your shoulder has been dysfunctional for a little bit. When I did that weird one, when I went out to the side a little bit, that weird butterfly-like test, I was testing to see the movement of the scapula going up and there as we raise up, and then coming back down to this area as we bring it back down. You want to have it pretty symmetrical if possible. Sometimes when there's injuries on one side versus the other, one moves a little bit more than the other. Yours was actually pretty good. This one moved a little bit less, but it wasn't significant for me to be like, oh my God, that's the cause of the problem. I really think that for you, if we look through here, let's add the muscles here. A lot of times the pain at night is a very common sign of rotator cuff injury. It doesn't, and I don't want you to freak out yet. Usually rotator cuff injuries do not go down past around like this attachment point, like right around here, especially at night. In the morning you might feel like a line, or like it kind of gets really stiff and achy here, and then you'll feel like some pain like that's there or there. I don't know if you felt that, but that's kind of what I'm noticing for you here. Okay, so let's get rid of the deltoid and we'll dive a little bit deeper into the rotator cuff. When we talk about the rotator cuff, we're talking about 4 different muscles, and these 4 different muscles are designed to take the ball and the socket and just hold it together inside the joint. That's it. It's that simple. We don't need to overcomplicate it. And all your muscles are completely 100% stable. There's nothing torn from what I can understand. And if it is torn, you still have full strength. You did have some weakness with certain movements, but you still have full, what I would call structural integrity, meaning it is healthy. Okay, I don't want you to freak out when I say you're having a rotator cuff syndrome.
Yeah.
That you're like, oh my God, it's torn. Because most people think, hey, I have rotator cuff injury, it's torn. When they say rotator cuff injury, people talk about this muscle. Remember that muscle that was like, hey, do you feel that?
Mm-hmm.
Well, let's take a look at this muscle. This is the supraspinatus or supraspinatus muscle. It inserts like back here. There's 2 of them, one on each side. And then it comes down and attaches here. So just imagine I'm touching the other side. It attaches like right to here. So a lot of times people have pain with that, right? And what can happen is that because this muscle runs right underneath, the AC joint or the part of the clavicle and stuff like that, and the scapula here at this connection point, this is the AC joint, acromioclavicular joint. This muscle runs deep and underneath like a tunnel. So imagine if a tunnel got smaller, it would be harder for that muscle to run through, right? That's what I think is happening a little bit, is that you're getting some movement. When we do stuff like this across your arm, what we're doing is we're taking that head of that humerus right here and we're rotating it inward. This is the greater tuberosity, this is the lesser. So imagine one mountain that's larger, greater, one mountain that's smaller, the lesser. When we take that rotation like this way, we rotate the greater or the larger mountain inward, and that can compress a little bit of that supraspinatus tendon. So that's why going stuff like across your arm like really kind of hurt you, but then I did stuff like this and I opened it up, that mountain moves back a little bit. And so it actually creates more space in the shoulder joint doing this than doing this. So you did have a little bit of weakness, and I actually think it's more of like I'm going to just use a general term right now, tendonitis. I think as soon as you get some muscle work on there, you release some of the muscles, you re-stimulate some of the rotator cuff, all 4 muscles, you get the shoulder joint and the shoulder and the posture in position, just like what you're doing in physical therapy, and you really align the shoulder with the ear and the shoulder and the scapula together, and like this thing is not an issue for you.
Interesting.
Yeah.
I would want it to be not an issue.
If this left unchecked long term, you probably have tendonitis, it goes away, then you have tendonitis again, then you start taking an MRI, and you get like 10 years down the road, you get a fraying, you're like, oh, I have a rotator cuff issue, and now you're like, oh, the rotator cuff issue is not really a bad issue, and then another, 10 years down the road, you're like, dude, I need surgery.
Yeah.
Like, that's how this stuff happens.
I don't want surgery.
Like, it's long term, but, this is like an easy problem to fix.
Okay, cool.
Typically,
That
you
is
just
very
need some
nice.
you just need some soft tissue work. You need a good amount of rehab. I already trust that they're doing the right stuff with that. It's pretty easy in that sense. You really just need to bring good control of that scapula and really learn how to increase your posture a little bit better.
Okay.
One thing that I wanted to chat with you, I asked you a couple of questions about your core. Remember what you said?
I don't have a core.
Yes. It wasn't terrible, but you didn't have good what I call motor control of it. I tested it, and what I still noticed is an arch. I remember when I was like pushed down into my hand here, you weren't able to like
move it.
do that, like that type of positioning, which is a huge influence on the hips, which is what your issue is, and on your core. So we have this thing that we call in fancy words called the kinetic chain. Imagine a chain that's linked to another chain, right? Like what you do with the hips and the pelvis, the core, influence, let's just say this is your core. This has to fire, and when this fires, it puts the pelvis in the right position. When the pelvis is in the right position, hips are in the right position. When the hips are in the right position, the knees in the right position.
That's all.
And then it goes down. So we call that the kinetic chain. Most people know it as compensation and like how things are aligned. Everything's connected. That is what people say.
Kinetic chain release.
That's exactly, yeah. Kinetic chain release is really, it would be a way of saying once we release one thing, we're able to kind of stimulate other things. This is, I mean, there's no way you can work just the quad muscle without working the knee or the hip, right? So it's saying that things are connected. Your best bang for your buck is to get the core this strong, because if this doesn't get strong, it doesn't matter how your pelvis position is, because it's always going to be throwing off.
Interesting.
Now, we can do things to help alignment. We can do things to help strengthen the quad and the knee at the same time. But you have to also realize that if you don't get some core control back, no matter how much I adjust you, no matter how much knee strengthening you do, you're going to possibly throw it off all the time, because even if this is weak, that means this is weak. And if this is weak, that means part of the hip is weak. And that means that it doesn't necessarily mean that the pelvis is weak, but it means that this kinetic chain is off from here to here. And the only way to get this into a better alignment is to not only strengthen this, but you have to strengthen the core.
Yeah.
So
I've never focused on that.
Your best bang for your buck, if you had to like run out the door right now and say, I got to do something for my life, I would say you need to strengthen your core.
Okay.
Do not do sit-ups. They're the worst thing for your spine. You will come back here with a disc issue in the future. Long story short.
Okay.
Just don't do sit-ups. They are not a great core exercise. Period.
Okay. What are good core exercises?
That's what's going to be a good question. And I'm going to throw a bunch of different things at you. Okay. And we're going to figure that out. And that's why I was doing some of that alternating patterns to see if it would stimulate your hip popping, and I don't want that to happen right away. So I think I have some other things that we may have to do, and I think we may have to like regress a little bit in order to progress. Okay. I'd rather kick the soccer ball back one player so that they can boot it forward too.
Okay.
And once you get that down, it's pretty simple.
Okay.
Okay. Any questions on that? Because
not,
for your knee, like it's just some timing and healing, but like if that stuff doesn't give you a good alignment, like your knee is always going to be the issue.
Exactly.
Always. You're always going to have knee pain. You know why? Because you're putting pressure on the knee because your core can't put the hip in the right position, or the pelvis and the hip can't put the knee in the right position.
Exactly.
And like you're going to constantly play these games of like, well, why is my knee hurt again? I thought I scoped it out. I thought I fixed it. Yeah, you did. But you never fixed the problem. You fixed the symptom.
Exactly. That's how I feel it is.
And that's like hopefully that's a big kick in the butt and like, hey, we got this.
I hope so.
Yeah. So our goal, like, because you are on track with what you said, like my hips and pelvis are aligned, like aren't aligned, we need to focus like from here to like here. Maybe a little bit further out.
Okay.
Give or take. That's going to be our big takeaway. Of course, like really focusing within there. And then with the soft tissue work with your shoulder, we'll be working those rotator cuff muscles and stuff like that, and working some of the ligaments to give it some more space and freedom.
Oh, yes.
So, cool. Any questions?
I guess the only other question I have is like with my hamstring, like just even sitting like this and putting pressure on my leg, like it like pops.
Yeah. I've heard about that before. I
Really?
tested
Ooh.
your hamstring though, like strength wise.
And it shouldn't be. It doesn't affect anything.
I don't. I'll be honest. Like, I don't know. I don't know.
Okay.
I don't see it being an issue because I tested it to
Yeah.
make sure there was no like hamstring tear because I don't like popping and clicking, but I can pretty much guarantee like
You don't like popping or clicking?
like
Every
it's
part
not
of me pops.
like it's not that bad, like popping and clicking. Like the issue is really like if we think about the core. I have to mention one more thing. When people think core, they think here and here, right? I think this abs. Here's the truth. The core is here to about here, 360 degrees around.
It's everything.
It's literally from this
Yeah.
breastbone, just the bottom of the breastbone, to about the top of the knees or about the knees, 360 degrees. So if you just are focusing on this, you have no core strength. If you're focusing just on this, you have no core strength.
You have to do all.
So when we do this, we're going to be giving you pelvis and hip-based exercises that work not just the front, but the back.
This is exciting, and now I'll have the time.
Because now you will be building a butt, you will be building abs, you will be building hip strength, and then that will allow all the PT that you are doing to really allow you to put the hip into the right position. It can put the knee in the right position. It can put the ankle in the right position. Now you have a full-blown alignment. And then, like, because your core is strong, you can actually retract your shoulder blades. Like, it all stems from there. Like,
Okay.
literally everything stems from there. Like, if we don't do this, like, you will never get this, or even this little finger to work right.
Yeah.
Promise you that.
Okay.
So, any questions on that?
No.